Welcome back, everybody, and this is Dr. Q, your favorite gynecologist, and again discussing female health matters. So today, after our pap smear video, if you haven't watched our pap smear video on what a pap smear is, how is it done, and all of that information, please go check it out. And today it is just a follow-up because we have a lot of patients coming in then saying, I was told I have cancer on my pap smear, or I was told I have abnormal cells. Am I dying? So today I just thought, let us just break it down a bit as to what are the possible results that one can get from a pap smear, and what do they mean? What do they literally mean to your life, and how are you affected, and what can you do about it? So, starting with a normal pap smear. Your pap smear can actually come back saying normal. There are women that are scared of actually testing or going for a pap smear screen because they are scared of abnormal results. You can actually get a normal, you know that, right? So, a normal pap smear actually means there are no abnormal cells that were detected on the mouth of the womb. Remember, we said HPV leads to cancer of the cervix, and it is a sexually transmitted virus that leads to cancer of the cervix. So, if your doctor has tested for HPV, it will actually come and tell you whether HPV was detected or not. So, if your pap smear comes back saying normal, then you can repeat your pap smear every 3 years. If it comes back saying normal, but HPV, human papilloma virus positive, a high-risk type of HPV is positive, then we need to repeat that pap smear more frequently. Others will say at least once a year to get checked that the HPV has not progressed, to make the cells progress to an abnormal pap smear result. Now, what is abnormal? Abnormal can either be, and I always have this in my practice as well, just to demonstrate what the cervix actually looks like and the different possibilities of an abnormal pap smear. Now, just on the upper right quadrant, this is a normal cervix. So if a sample of these cells are taken, it can come back saying normal. Whether HPV is positive and not causing any abnormalities is a finding you will know when you test for HPV DNA. So the cells can be normal but infected with HPV, meaning there is a higher risk of developing cancer of the cervix in the future, or the cells are normal without any HPV, and that's when you can do your pap smears every 5 years at least. Now, if HPV is present, then HPV has some affiliation with the cells of the cervix. It just likes going in there and chowing them, and then starts making them abnormal, and then they all get all excited and they just start growing non-stop, and it just becomes chaotic, and that's how cancer eventually develops. So there are certain levels of abnormalities. There's grade 1, which is what they'll call a low grade cell. So this stands for squamous intraepithelial lesion, meaning the cells of the cervix have a lesion which is associated with abnormal cells, and mostly cells that are infected with HPV have now become abnormal, leading to a low grade abnormality. This means that over time this can regress to become normal cells again. That's why we say check again in 6 months. Let's see, maybe there is some regression. This is highly possible in ladies that are less than 30 years of age. Now, this low grade lesion can in 6 months time actually also progress instead of regress. So when it progresses, it can end up becoming a high-grade lesion, meaning that the cells here are more affected and more damaged and more precancerous, meaning there is a higher chance of actually developing cancer in the future. Now, with that being said, what does it mean for you? No, it does not mean you have cancer. It is a precancerous lesion. It's a lesion that can lead to cancer, but for now, it's just abnormal cells. Good, you got your pap smear done. You see now, this is where cure comes in. So, if high-grade cells are found, then we take you for a procedure called colposcopy. This is when we look at the cervix under a microscope and we then stain with certain chemicals, and we are able to see the layer of cells that is actually affected, or that area of cells that is affected. When that area is detected, we are then able to do a small procedure. It's a day procedure, and you get a local anesthetic, and a small loop is used to actually remove those abnormal cells. Now that procedure is called a LETZ, L-L-E-T-Z. It's a large loop excision of the transformation zone, which is the area that is actually affected. Alright, so we remove those abnormal cells, and most women actually, they come back after 4 months, do a pap smear, and voila, the abnormal cells are gone. Good, you got your pap smear done. Aren't you safe now? That's the reason why we actually recommend doing pap smears, because early detection can actually lead to a cure. Now, other abnormalities that can be found is what we find here at the 4th quadrant, where from normal, nobody actually looked under and no pap smear was done, we got a low-grade lesion, no pap smear done. The lesion grew to a high grade. Fortunately, some people came through and a colposcopy was done and we removed the cells. No more abnormal cells. If you have not done your pap smear, by the time you wake up, we will be on the 4th quadrant, which is cancerous cells. So that is another abnormality that can be detected on a pap smear, where cancerous squamous cells are detected, or it says carcinoma in situ. There, then, a biopsy needs to be taken of the lesion that is found, or the area that is detected to be abnormal, and that a histological report is required in the laboratory, and cancer can then be diagnosed. Even then, if we are able to catch the lesion quite early, there are numerous surgical operations that can be done to save you before cancer spreads to the rest of the body. So just in a nutshell, these are the abnormalities that can be detected by a pap smear, and you'll be saved from a lot of other conditions that can develop just from a small lesion that can be there. Again, this is Dr. Q, your favorite gynae. Join us again when we talk other issues, gynecological, female issues, and see you again next time.